So here we're going to look at massage tool for the forearm. So using instrument assisted soft tissue mobilization, or IASTM. So let's talk about the tool. So here I'm just using an inexpensive jade gua sha tool, but you can use an IASTM, so instrument assisted soft tissue mobilization blade, if you've purchased one online or you are a massage therapist or fitness pro yourself. So feel free to use whichever you have. Now, the tool is really important because that is how we're going to target that layer under the skin. So pressure, let's talk about pressure. This should not be painful. It's a light pressure, 45-degree angle of the tool. And as you can see on these scales, it's about 50 to 100 grams. So it's a light pressure allowing you to feel the tissue. So let's look at the technique. So again, we're targeting those muscles on the inside of the forearm, those wrist flexors. And I've just applied a little bit of oil here. Now take that tool, 45-degree angle. So we're looking to hit that fascia under the skin. So we're not looking to dig into muscle here. And I'm just stroking the tissue, that connective tissue on that inside of the forearm for the golfer's elbow or for that inner wrist pain, grip pain. And then I start adding movement. Just flexing and extending. And what you'll find is there's places where it feels like nothing, feels really smooth, and other places where it might feel crunchy, a little uncomfortable. But this should never be painful. It might feel uncomfortable, but if it's painful, you're using too much pressure, or perhaps it is too much for your tissue at this time. As you can see, I'm moving around. I'm following where the tissue feels tight, changing the directions in which I move the wrist. So pronating, supinating, rotating, flexing, extending the wrist, and a little bit of side bend, that radial or ulnar deviation as well. Move in whatever way feels good. Now, to summarize. Apply some oil or lotion to the forearm. Use a 45-degree angle, really important. Fascia loves shearing forces. So we're targeting that layer just under the skin, not digging into muscle. And start to rub lightly that 50 to 100 grams of pressure with the tool. When it feels comfortable to do so, add movement. We want to create this ease in those tissues when you move. Flex, extend, pronate, supinate, whatever feels good. Perform daily until you start to see an improvement in the level of tone, that tightness in the forearms. Once that improvement is there, then perform as and when you feel you need it, based on your daily activities and exercise routine. Avoid working directly or on areas that feel acutely painful.